Health, they say, is wealth. That is why some people say an healthy person is a wealthy person. This implies that when a person's health is affected, the person's potency is bleak. Good day, viewers. Welcome to another exciting episode of Health Matters on Junior Osun 406 TV. I am Olorire Ojo. On today's episode, we'll be talking about chronic kidney disease. According to International Journal of Nephrology and Renovascular Disease, chronic kidney disease is defined as kidney damage or glomerular filtration rate. Chronic kidney disease is a world public health problem with adverse outcomes of kidney damage, cardiovascular disease, and premature death. There is an increase in the prevalence of chronic kidney disease. About 10% of world population is affected. There are various ways by which the kidney can be damaged. Diabetes and high blood pressure are the most common factors. However, obesity, smoking, genetics, gender, and age can also increase the risk. I will not be doing justice to this alone. I have a general practitioner who will be guiding us on the topic. Before I introduce our guest, let us go on a short break. I'll be right back.
Kidney failure happens when one or both kidneys stop functioning normally. This could be due to infections, urine elimination problems, or some underlying diseases. Instead of being excreted, waste like urea, creatinine, uric acid, and ammonium ions remain in the blood. Accumulation of these substances is toxic to the human system and could prove to be fatal if not treated in time. The treatments currently available are dialysis or a transplant. Dialysis is also called hemodialysis. It is a process or procedure to eliminate excess salts and nitrogenous waste from blood. It does not absorb or secrete anything. During dialysis, the patient's blood from the modified blood vessel in the arm is passed into a dialysis machine and returned after being cleaned. The dialysis fluid is changed regularly to remove wastes and maintain a diffusion gradient between the patient's blood and the dialysis fluid. The dialysis machine contains the following parts: a steel tub with a filter filled with a warm fluid set at 37 degrees Celsius to suit the patient's body temperature. The machine also has a narrow tubular coil of cellophane with pores and a sterile dialysis fluid.
Welcome back to the program, Health Matters on Junior Osun 406 TV, still on chronic kidney disease. Our guest is Dr. Akintola. Good day, sir.
Thank you so much.
We are very happy to have you on the program today.
It's a privilege being here.
Can you please tell us more about yourself?
Yeah, my name is Akintola. I'm a medical doctor by profession, also a medical officer, what you have called general practitioner, and I work at Kwara Puli Medical Center in Kwara State.
That is nice to hear, sir.
Thank you for having me.
Can you please tell us more about chronic kidney disease, sir?
Yes, you have done a good job by your definition. So chronic kidney disease emphasizes on the failure of the kidney. But before we understand the definition, we need to understand what the kidney does. The kidney helps in excreting excess water and toxins from the body. So the ability of the kidney not to be able to perform that function is what we call kidney failure. So kidney failure, in a simple term, is the loss of that capacity of the kidney to excrete excess water and remove toxins from the body.
Okay, sir. Sir, how many years have you been on this field? And based on your experience, how many chronic kidney disease cases have you come across, sir?
Yeah, that's a very good question. As regards the number of cases I've seen and the number of years I've practiced, I think just within a year, being at the Osun Hospital, just for that, when I was training as a house physician, I think without exaggeration, I saw about 20 patients with that condition, varying from mild to moderate to severe or to the end stage renal disease itself.
Okay. Sir, Is chronic kidney disease something that can occur overnight, or what are the causes of?
Yeah, fantastic question. Anything you call chronic, when you say overnight, or in medicine, overnight means acute, meaning that it's happening now. So the meaning of chronic means that it has taken over a month and over years. So just to answer your question, it doesn't happen overnight.
Okay.
So as regards the causes of this condition, you have mentioned a few, but just to put it in perspective, we have what we call primary causes and secondary. Primary causes suggest that these conditions is arising from the kidney itself, while secondary suggests that it's arising from something affecting other part of the body that is not affecting the kidney. That is, secondary means that it's not primarily affecting the kidney, it's affecting maybe another organ, then affecting the kidney. So because of want of time, I will emphasize more on the secondary, which is the more common ones. Okay. So like one, the causes include uncontrolled hypertension, just like you said, high blood pressure. We have uncontrolled diabetes mellitus, which is second most common cause. And the third common cause is, we call it nephrotoxins. Nephrotoxins means, let me explain this way. Nephrotoxins are substances that affect the health of the kidney, which ranges from drugs such as NSAIDs. A number of times people are tired, they take analgesics, ibuprofen, diclofenac. Once you take it so much, it affects the kidney. That's one. Two, nowadays females, they want to look like Angelina Jolie. They want to look white when they were born black. So they use a lot of beauty creams that contain steroids. So that is also one of the more, like now you said in your introduction, that is now more common. That's one of the reasons why it's more common now in our side, because people are using beauty products which contains high steroid. The third thing is upper concussion. In Africa here, everything is we get there, so that's also a contributing factor. And the fourth one is use of drugs. I mean hard drugs, cocaine, heroin, and sometimes injectables like gentamicin, and drugs in that group, they affect the kidney. So that's 3. 4 is we call it dyslipidemia, and that is when you have fats, deposition in the body. The 5th one, just for a amount of time, is any condition that affects the passage of urine. So such as like a male, maybe they have prostate enlargement. So people with the calculi, that is kidney stones, people with renal tumor cancers, bladder cancers, whatever prevents urine from flowing from the kidney down out can also result to, and also most importantly, recurrent urinary tract infections, what we call also pyelonephritis. So those are the conditions that causes chronic kidney disease.
Yeah.
Thank you.
Sir, does kidney disease have stages like cancer, and what stages of kidney disease can be referred to as chronic?
Yeah, that's a good question as well. Just as you have rightly asked, it's like cancer, not like cancer, because cancer is way different, but it has stages. So we have 5 stages. We have stage 1, stage 2, stage 3, stage 4, stage 5. Stage 3 we have 3A, 3B. But I'm not going to bore you with what the stages includes. But stage 4 and stage 5 is what you refer to as chronic, because people with stage 1, stage 2, stage 3, they may be asymptomatic, which means that they may not have any symptom to show that they have chronic disease. And maybe I forget, the definition is a progressive loss of kidney functions. So stage 4 and stage 5 is what we classically call chronic kidney disease. So we have 1, 2, 3, 4, 5. 4 and 5 is that. Yeah.
Okay. Sir, chronic kidney disease.
Yeah.
There are so many symptoms of chronic kidney disease.
Yeah.
High blood pressure, anemia.
Okay.
So what are the other symptoms for chronic kidney disease?
All right, that's also a very wonderful question, because if you don't know the symptom, then presenting will be quite difficult. So as I've mentioned, you mentioned hypertension, you mentioned anemia. So let me take it in the correct order. Now, I said earlier before that stage 1 and stage 3, stage 1 to 3, do not come with any symptom really. So part of the symptom, when time you start seeing symptoms, starting from stage 4 to stage 5. So from the milder ones, nausea, that is a feeling of trying to vomit. Then in severe forms, you are vomiting, and we have what we call encephalopathy, that is, it affects the brain. We call it encephalopathy. So it presents as lethargy. The person doesn't want to do anything, just tired. Somebody can have seizure, that's convulsion. And also the person will have bizarre behaviors. The person is gentle before and start behaving start beating, mood swing, anger, the like. So that's one. Another thing that they could have breathing difficulty, called the pulmonary edema. That is, the body now have lost functions to remove the fluid, so the lungs become congested. So they could have problem with their breathing. and that is usually that kills faster than the number of the other symptoms. The other symptoms you could see, they could have itching, severe body itching because of deposit of uremia. Those toxins could not leave the body. They could have severe itching. They could have dry skin, and also one other symptom that we see with them, like I mentioned, is anemia. But just to make it clear, that they have reduced blood level because the kidney is responsible for producing the blood cells. So once the kidney is faulty, anemia sets in, so they are tired, they can't do so much, any little exercise or anything little work, they are down. So that's just to mention a few, yeah.
Okay. Viewers at home, I hope we have been able to get one thing or the other. We'll be right back to talk about the treatment for chronic kidney disease. Stay tuned.
With pores and a sterile dialysis fluid, the tubular coil of cellophane is semi-permeable in nature. It allows small molecules to pass through, prevents blood cells and large proteins from leaving, and provides large surface area for material exchange. The sterile dialysis fluid surrounds the cellophane tube and contains regulated amounts of dissolved salts and sugars. Once a kidney fails, there are very rare chances of it healing. Hence, this procedure has to be carried out until the kidney is replaced with a new one. Transplantation is a major operation through which a failed or dysfunctional kidney is replaced with a healthy one. Kidney transplant is associated with better quality of life, lower risk of death, fewer dietary restrictions, and lower cost of treatment compared to a lifetime on dialysis. You can keep your kidney healthier by keeping yourself active, maintaining your weight, controlling sugar level and blood pressure, avoiding over-the-counter pills, avoiding smoking, and also maintaining a healthy fluid intake.
Welcome back to Health Matters on Junior Ocean 406 TV. If you are just joining us on the program, today we are discussing on chronic kidney disease, and we are joined by Dr. Akintola.
Thank you.
Dr. Akintola, please, I want you to tell us the treatment for chronic kidney disease. Is it curable?
Okay, yeah, that's also a good question. Yeah, in terms of curable, I think we have to shift from the word cure, because the goal of treatment really is, one, to stop or halt the progression of, I said that kidney failure means that there's a loss in the function and it's a progressive condition. So the treatment is, one, you want to stop that progression. Then you stop it or you delay the progression. Sometimes you cannot stop, you can only delay it. That's one. Two is that you want to treat the complication arising from this condition. So just to answer the question more clearly, in terms of halting, don't forget that I said that the risk factors include hypertension, diabetes, dyslipidemia, a number of them. Now, so what if you are going to treat them, then you need to deal with what is causing it. So, for example, hypertension, there must be proper blood checks, there must be proper blood control mechanism. So it means that the person will regular on what do you call it now, on medications. Now, for diabetes, you have to also control the glycemic. We call it a glycemic control, good glycemic control. So that's two. Now we talk of nephrotoxins. It means that there must be a stop in use of NSAIDs, all this diclofenac, ibuprofen. It must be reduced. Now the use of upper concussion must be reduced. Steroids must be withdrawn. So once those are done, so that is, I'm just explaining for the first three. Okay. Now, if it is caused by dyslipidemia, then you use drugs like statins to bring down the lipid level of the body. Now those that are caused by obstruction, you have to relieve the obstruction. For example, if there is a stone within the urethra and it's blocking, you have to go inside, then remove the stone. If there's a tumor somewhere, you resect the tumor.
Can you call that kidney stones?
Yes. So we have, we call it renal calculi. They are kidney stones that blocks that pipe that conducts the urine. Okay. So if there's like in prostate now, if the prostate is big and it compresses the urethra, we go to resect the prostate as well. So those are the management. So the only times where it becomes almost impossible. So as I said, curing is not the goal. It's just to take care of those symptoms causing it. Sometimes when it gets to end stage, the treatment is not more than replacement. Either we do a dialysis, that is regular dialysis, or replace the kidney entirely.
So can I increase their lifespan?
Yes. Dialysis will increase their lifespan. At least we give them a good life, at least, or total renal replacement, which in some cases. So yes, it should give them a more time to live. Let's put it that way. Yeah.
Viewers at home, this is where we come to the end of today's program. We appreciate our special guest, Dr. Akintola.
Thank you for
It's a
having
pleasure having you on the program.
Thanks so much.
A very big thanks to executive directors, Mr. Victor Adefemi and Dr. Mary Okocha, and to my amiable producer, director, and my crew. I am Olori Ojo. See you another time.